what again should we be looking at? Because the talk about the fruit bats and even the monkeys, and are we really certain that these are the carriers or the host of the virus?
We know that, yes. In Germany, in I think it was 1967, the first group for this Ebola, it wasn't Ebola, it was Marburg. They actually isolated Marburg virus from a couple of monkeys they brought in for some research work. They called them green monkeys. That was the first outbreak they had. And that's when we knew that, oh, monkeys can transmit this particular group called the Filoviridae. And, you know, from there they said they isolated in bats, fruit bats. And then they said, oh, yes, rodents have it too. But if we want to eliminate the virus from those animals, right now we don't know which set of animals, you know, brought this outbreak out. We don't know. So we can't just say, right, kill all the monkeys in West Africa. How do you start killing all the monkeys in West Africa anyway? You know, so that cannot be the strategy right now. It's a reservoir you can actually lay your hands on, like in the avian flu. You have the chickens. You can say, right, if you find one single case, you know, in this farm, we kill all the chickens in this farm. That's what was happening even then. But right now, we don't have a population of animals we can get our hands on. Where do you get the bats to kill all of them? Where do you get the rodents to kill all of them? That can't be our strategy. Although we do know that, yes, can we please stop eating the bushmeat? People don't want to stop that. Even I saw a documentary in Liberia, and there was this guy who was really angry. He said, there's nothing wrong with our monkey meat, and I do not want to hear anything about this Ebola business. It has nothing to do with monkeys. Sorry.
And there will be people like that.
I don't want to hear about it. I'm going to eat my bushmeat. I've been eating this bushmeat. Do you know how long I've been eating this bushmeat for? And now you're telling me that it can transmit Ebola. It cannot transmit. So they don't believe it. But we do have to keep talking about it. Please stop the bushmeat, because honestly, it could be a reservoir, and we can't go around killing all the animals. But at least no monkey meat, no rodents, if possible. And I don't think we eat bats here, but some people eat bats.
But at least primarily, it can be contacted through fluids from those who are...
Body fluids, you know, sweat, saliva. Unfortunately, you know, vomit. And so if you have somebody who's ill at home, very high risk of contamination, because somebody's going to help him out, you know, go to the loo, diarrhea. And that's where the problem is, really. That's why I say any sign we should insist on people being taken to isolation centers. Immediately they notice anything, not being cared for at home. Because even if they die, the dead body, the corpse is infectious. So they're not allowed, they shouldn't be allowed to bury anyone by themselves.
Can we look at the experience of Democratic Republic of Congo and learn anything from them?
Well, I think they allowed the epidemic to play itself out. I don't think we should do that.
Does it play itself out?
Well, if it isn't a massive one like this is the first big one. I think they had two outbreaks, and I don't think they lost more than 200 people. I don't think they lost 1,000. I don't think they had this on this scale. They had this sort of outbreak. So if it's a small outbreak, yes, you can, you know, just do your PPE, protect everybody and all that. It's probably wear itself out eventually. But now it's obviously not, and that was a small epidemic. This one is a massive epidemic. I don't think we can use their strategy, which is just what they're doing now, which is just more like, oh, we just do a defensive thing. We sit down, we prevent people from getting in contact with the contaminated people, all that. That may not work here, because this is a larger scale.
You know, I think we just want to get something clear here, because even a couple of other people have been asking questions, because we've had someone, a doctor like yourself on this program, that has said that you have to be really, really sick for you to be able to pass on the virus. Now, you just talked about our sitting position in buses, for instance, and if I sat with someone who's not looking really sick, or who's not really, really sick, and he has the virus, maybe it hasn't actually grown, will I get it?
The problem is that we don't know who is infectious yet and who is not. You don't have to be very, very, very sick.
You don't have to be.
I don't believe you have to be, because the way bacteria and viruses work, in the incubation period, you may still be infectious, especially when you start to, your nose starts to run, and the symptoms may be like cold initially. You start to, and you see every secretion is laden with viruses. Usually the viruses have hijacked the cells and started using the cells to turn out the viruses. That's what viruses do. They actually jump into the cell, they hijack the cell, and they say, you just produce copies of me, don't stop your own normal function and start reproducing my copies. And that's what happens. So all those extra copies come out in the secretions. So if somebody's sitting beside you blowing his nose and he's just feeling he has a sore throat, and you're telling me that person is not infectious, I won't believe that. Because in my public health training, once you start having secretions, you know you're infectious. That's the truth.
Yeah, one last thing from you. What, a lot of people are confused now, a lot of questions coming in. What should we be doing away from the awareness? You said, well, we should step up awareness from the government, from agencies, even the local government. People should speak up and get all of those centers close by.
Yes.
What, again, should we do away from awareness?
I think reporting, very important, because if individuals can report, I notice my neighbor has this, or I notice that someone in my family has that, reporting it is very, very important. And of course, we still have to follow the, no-touch system. Let's stop shaking hands, if possible, in areas that you're not sure. We're not sure whether there's any risk or not. Definitely in areas where there's very little water, no running water. Day to day, you notice that the hygiene levels are very low. Why would you want to go in there? And if anyone falls sick in such a neighborhood, don't go visit them at home. You don't know what they have. So that's me also. You have to take precautions now. Don't jump into anyone's home to go and visit. If somebody falls ill at home and they're vomiting and having diarrhea, don't get them to the hospital. Don't try and take care of them at home. Very important. Of course, avoid crowded areas. At the height of an epidemic, you're supposed to close down public places. You stop people from having parties and, anywhere where you can gather people who can contaminate others.
But we're not there
We're not there yet.
Nigeria.
Right now, it's just an individual thing right now. Everybody should just be careful. And, of course, hygiene. If one can improve on hygiene, they should try and improve on the hygiene.
But in the meantime, public health experts, maybe like yourself, have got to rally around Anambra to find out what exactly is
what's
going on
happening.
there.
Except anybody who has any symptom, they should go and get tested. The earlier we detect it, the better. If you have any symptom at all that looks like vomiting, diarrhea, with fever especially, or skin rashes especially, get tested. Very, very important. We need to be more proactive about it.
All right, Dr. Simbo Davidson is a public health specialist. Thank you for coming on this morning.
Thank you. Thank you very much.
It's time for the headline news. Aitine Balogun is standing by with that, and who knows, you may take a little while before you get to see him again now.